Where's your duster? You don't have duster? Today we are going to talk about the basal ganglia. All right. We are going to talk about what? The basal ganglia. When we are done with this, we talk about cerebellum, and then we talk about the limbic system, and then I think I'll be done. Right? Yeah, them down. Okay. Hello. So, what can you say about the basal ganglia? I think we said something about it the other time. What can you say about the basal ganglia? Basal ganglia. What can you say about the basal ganglia? Somebody should tell me something about the basal ganglia. My friend, say something. Say something. Yes. And you. Anywhere. Okay. This one is very close, very close. Very close. And this one, close, very close. And close. What of you, my friend? Say something about the basal ganglia. You can't tell me? Alright, I will tell you. You know, in our last class I told you that the basal ganglia, okay, let me say the basal ganglia are a group of nuclei. Right? They are a group of what? Nuclei. That are located where? In the base of the brain. Right? In fact, we call them subcortical nuclei. Group of subcortical nuclei. Right? Some people say they are scattered masses of what? Nuclei that are located where? The base of what? The cortex. Right? They are group of subcortical nuclei that are involved in voluntary what? Voluntary what? Movement. Or involved in motor what? Functions. Are you there? That's what basal ganglia is. Right? Group of subcortical nuclei that are involved with what? Movement. Voluntary what? Movement. Or voluntary what? Motor what? Function. Are you there? So it's very simple. It's not a difficult task. Or neither is it an peculiar what? Task. It's as simple as that. Are you there? So for them, that terminology seems to be very wrong. Are you there? That term, basal ganglia, seems to be very wrong. But we call it basal ganglia. We don't have any choice. Right? It's there in the books. We call it basal ganglia. We don't have any choice. But it seems to be very wrong. Why is it wrong? Why? Ganglia is what? Collection of cell bodies that is located where? Outside the CNS. Are you there? That is located in the peripheral nervous system. While nuclei are a group of what? Cell bodies that is located within the central nervous system. So we are supposed to call it basal nuclei, not basal ganglia. But the book says we should call it what? Basal ganglia. That is why we are calling it basal ganglia. Are you there? Are you there? So now the question is, what are the components? What are the components? We have defined it, right? We have defined it. And also you should know that the basal ganglia is associated with other structures, right? It is associated with other structures like the cortex, right? Like the cortex, that is, when I say cortex, I'm talking about the cerebral what? Cortex. And it's also involved with what? The corticospinal what? The corticospinal what? Tract. And it's also involved with the thalamus. It has an involvement with what? The thalamus. So all these structures are related with the basal ganglia, right? They have link, connection, right? With the basal ganglia. Even the brain stem, it has a connection with the brain what? Stem. Well, what are the components of basal ganglia? What are the components of what? Basal what? Ganglia. Now, if you would agree with me, what are the components of the basal ganglia? Let me draw a diagram. Where's your marker? Classroom, where's your marker? Do you have marker? Where's your marker? Give me marker. If you have marker, give me. Please, if you have marker, bring it. Max, don't have it. Bring this one first. Let me move this one first. I want to want to let me. Oh yeah, that bring. Okay, you can refill. Okay, don't worry. Let me use my head. All right. So you can see this is the cortex, right? This is temporal lobe, this is midbrain, right? What is? Pons. Now, you know that the beta ganglia, like I said, is related with other structures like the thalamus, right? So we should have our thalamus here. Right? What is this? Third ventricle. What is this? The thalamus, right? Alright. Now, if you would agree with me, we have another structure that is here. Now you see that? Right? Alright, so these are what? The thalami. Are you there? These are the what? Thalami. And then, when you move down, you have what? This is called lentiform nucleus. Right? Lentiform nucleus. Right? And then we have another structure here. That is called the caudate nucleus. Are you there? We have another structure that is called what? Caudate nucleus. Then we have another structure This one is called subthalamic what? Nucleus. And then we have another structure here called what? The substantial ligament. So this is called nucleus, right? This is lentiform nucleus. Are you there? Caudate nucleus, lentiform nucleus, right? Subthalamic nucleus, subthalamic nucleus, substantial what? Substantial diagram. This is what? Caudate nucleus, right? This is what? Lentiform nucleus. Now, the lentiform nucleus consists of two structures, right? This one is called, this is one, this is another one, right? This one is called putamen. Then this one is called what? Globus pallidus. Globus pallidus and putamen and globus pallidus gives rise to what? The lentiform what? Nucleus. Then we have the caudate what nucleus, the subthalamic nucleus, the substantial what diagram. Then there is a structure here. There is a space here, right? There is a space here, and there are structures that passes right in this space that is between the thalamus and the lentiform nucleus. There is a space there, right? And we have a collection of white matter, right? A collection of white matter. What do we call that? We call that what? We call that the internal capsule. Are you there? So we have the internal capsule here. Are you there? That's our internal capsule. Okay. All right, let me draw again. Let me draw it again. Yeah? Now, what is this? What is this? This is the thalamus. Right? That's the thalamus. You see also? Here you have this structure here called the what? Lentiform what? Nucleus. Are you there? In between the lentiform nucleus, you have what? The internal capsule. Right? You have the internal capsule that is bilaterally what? Located. Are you there? And then we have the caudate nucleus. Right? Actually, the caudate nucleus has a head. Right? It has a head, it has a body, right? And then has a what? A tail. Do you agree with me? It's like this. So we have the head of the caudate, the body of the caudate, and the tail of what? The caudate. Right? And then we have the internal capsule. The what? The thalamus. Now just picture this like this is like a rat. A rat that has a body, a head, a body, and it what? A tail. Right? Are you there?
Yes.
That is interested in eating up this what? Cheese. This is like a cheese. He's interested in this cheese. And this is like an egg. The thalamus is like what? An egg. So you will not forget it. Then this is what the internal. Then when you go further, you have what we call what? You have external capsule. Yeah. Are you there? The lentiform nucleus is inside the capsule, right? This one is called internal capsule. This is called what? external capsule. When you go further, you have what we call what? Classroom. Are you there? You have what we call what? Classroom. And then when you go further, you have another one called what? The extreme capsule. So this is classroom. This is extreme capsule. This is what? This is external capsule. This is lentiform nucleus. This is what? Internal capsule. This is thalamus. Do you understand?
Yes, sir.
You get it? Now, the components of the basal ganglia are what? The first one is what? Caudate nucleus. Are you there? The second one is called what?
Lentiform.
The second one is called what? Putamen. Are you there? The third one is called what? Globus pallidus. We have what? Subthalamic nucleus. And what? Substantia nigra. Are you there? These are the components of the what? Basal ganglia. It consists of what? The caudate nucleus, the putamen, the globus pallidus, subthalamic nucleus, substantia nigra. The thalamus is not part of it. Right? The thalamus is what? It is not part of it. In fact, we say that the structures or the components of the basal ganglia are lateral to the thalamus. Are you there? They are what? They are lateral to the what? To the thalamus. All of them, you can see all of them here. They are lateral to the what? Thalamus. So the thalamus is not part of it. It's just a structure that is related to the what? To the basal ganglia. But these are the components of the basal ganglia. Now, if you would agree with me, three of these structures are called what? The three of these structures are called what?
Input nuclei.
We call it what?
Input nuclei.
Input nuclei. We call it corpus striatum. Are you there?
Yes, sir.
We call it corpus what? Striatum. Then, two of these and this. The caudate nucleus and the putamen is called what? The caudate nucleus and the putamen is called what? It is called neostriatum. If you don't call it neostriatum, we call it striatum. Are you there? So this is called neostriatum. Are you there?
Yes, sir.
Then the globus pallidus and the putamen. The globus pallidus and the putamen is called what? The putamen and the globus pallidus is called what? It's called lentiform what? Lentiform nucleus. You get it? So corpus striatum is all of them, right? Putamen and caudate nucleus forms this striatum, or what we call the neostriatum. Then the globus pallidus and the putamen is called the lentiform what? Nucleus. Right? Then the subthalamic nucleus and the substantia nigra are also part of what? The basal ganglia. Do you understand? Or am I speaking Latin? I'm speaking Latin. Alright, let's go to the circuit of the globus pallidus of the basal ganglia. Circuits of the basal ganglia. Circuits. When we talk about the circuit, we now talk about the function, right? But let's talk about this. Let me keep this one here. While you do like this. All right. So, how many circuits do we have? I have entered. Okay. Enter. Have you heard of the putamen circuit? It's called it circuit. Have you heard of that? We have what we call the putamen circuit, and they call it what? Circuit. Are you there?
Yes, sir.
Then when we talk about the functions, we now talk about the direct pathway, the indirect pathway, and the nigrostriatal what? Pathway. Right? But let's talk about the putamen circuit and what? And they call it what? Circuit. Now, the putamen circuit is actually involved in what? Who can tell me what it is involved in? The putamen circuit, can I clean this?
Yes, sir.
But don't clean that one.
Which one? This one?
Yes, sir.
Do this, sir. The putamen circuit. Okay, so okay. All right. So now, all right. So now when we talk about the putamen circuit, right? It actually begins from the cortex, right? But which part of the cortex? You remember in our last class where we talked about the cortical what? The corticospinal what tract, right? Let's say this is the cervical view of the brain. You remember that we said we have a sulcus here called the central sulcus, right? In front of this sulcus, we have what we call what? The precentral gyrus, where we have, which in that area, we have what we call the primary somatosensory what? Okay, primary what? Cortex, right? And then we have another area, which is called the premotor what? The premotor what area? This area is area what? Area 4. This one is area what? Premotor area, premotor cortex, right? Or area is what? Area 6. Right? Premotor area. Then we also have another area called what? The supplementary what? Area. Which is also area what? 6. Then, behind this, we have another one called the what? The primary somatosensory area, which is known as what? The postcentral what? Gyrus. Right? Now, all these are involved in motor what? Motor functions, right? And they send information down to the what? Down to the spinal cord. Is it also? It is. They send information down to the spinal cord that goes down to what? To muscles, right? It goes down to what? Muscles, skeletal what? Muscles, right? But before they send information via the corticospinal tract, they will first of all send information to an area called the basal what? Ganglia. The basal ganglia will receive this information, process this information, and send what? A command, a final command to the what? To the muscles via the what? Corticospinal tract. Are you there? And the neurons that are located around this area, neurons, and the neurons that are located the spinal cord are called what? Lower what?
Neurons.
Motor neurons. So you know what upper motor neurons and lower motor neurons are? Are you there? But what I'm trying to establish is that we have some areas that are involved in what? In motor what? Functions, right? So now for the putamen circuit, right? Information will come from the premotor area, right? This is, let's say this is this is placenta gyrus, right? All right. So information will come from I here. I go where? This is what? Putamen. This structure here is called what? Nucleus. So it will bypass the corded nucleus and come straight to what? The putamen. Are you there? From the putamen, the structure will go down to where? It will go down to the what? Globus pallidus. Now the globus pallidus, listen. The globus pallidus, I've cleaned that diagram. The globus pallidus is divided into two, right? Right. Okay, let me use this one. This is putamen. This is globus pallidus, right? Now we have two types. Now the globus pallidus is divided into two. We have globus pallidus internus and globus pallidus what? Externus. Are you there? Are you there? The substantial nigra is also divided into two. We have the substantial nigra pars compacta, right? The substantial nigra pars compacta, and substantial nigra pars what? Reticulata. Pars compacta and pars what? Reticulata. Pars compacta actually produces what? A neurotransmitter that is called what? Dopamine. Are you there? Are you there? All right. So we have the globus pallidus internus and the globus pallidus what? Externus. So fibers that are coming from here will be the putamen. From the putamen, right? Fibers will go down to the globus pallidus what? Internus. Are you there? The globus pallidus what? Internus, not the externus. Now we have globus pallidus internus, globus pallidus externus, and this is what? Putamen. Are you there? So it will come direct to what? The globus pallidus internus, and from here it will go to the what? To the thalamus. This is thalamus. It will go to the what? To the thalamus. So which particular area in the thalamus does it go to? We said that in our last class. It will go to where? Yeah? Yes. Don't say it. Let them say it. It will go to where? Yes. It will go to ventral anterior and ventral lateral what? Nucleus of the thalamus. VA and what? VL. These are the areas that are involved with the function of the basal what? Ganglia. So from here, information will go back to where? It will go, instead of going to this is what? Premotor area. This is supplementary what? Motor area. This is primary what? So the information started from where? The premotor and the supplementary area. But this time around, it goes straight to the what? Primary what? Motor what? Area. And then it can now, from the primary motor area, it can now go to the what? Premotor area, the supplementary what? Motor area. Are you there? Now, this particular circuit is actually involved in what? In what is it involved with? In execution of what? Complex pattern of motor activities. The putamen circuit is involved in the execution of complex pattern of what? Motor what? Activities. Bicycle, shoveling, and all that. Right? Those activities that involve complex patterns are actually modulated by the putamen what? circuits. Did you get that? Did you get that? Alright, so we can proceed. Let's proceed. Can I clean this? The next circuit is the coded circuit. The next circuit is the coded what? Circuit. Can I clean this? Can we go on? Shall we? Shall we proceed? Alright. The next circuit is called the coded what? Circuit. Coded circuit. Now, this particular circuit begins from where? Where does it begin? From the premotor area and what? Supplementary what? Motor area. Are you there? It begins from where? The premotor area, right? The supplementary motor area, and where does it go to? It goes directly to what? To the coded nucleus. Direct. It goes to the what? Coded what? Nucleus. Are you there? Now from the coded nucleus, it goes down to where? To the globus pallidus internus. Right? It goes down to the globus pallidus what? Internus. Then it goes from the globus pallidus internus, it goes down to the what? To the thalamus. That is the VA here. From here, it goes back to the supplementary motor what? Area and the premotor what? Area directly. You know, in the putamen circuit, it goes directly to what? To the primary motor what? Area. Are you there? That is directly involved in what? Sending command to what? Initiate movement. Do you understand? But this one goes to the premotor area and the supplementary what? Motor what? Area. So it comes here and what? Comes what? Here. And this is actually involved in what? What does it involve in? Okay, I will tell you. It is involved in what? In modulating what? Who can tell me? Cognitive, right? Cognitive functions that is related to sequence of what? Motor what? Activities. Or motor pattern. Motor what? Pattern. Of complex motor pattern of activities. Activities or complex activities. Cognitive functions that are related to sequence of motor pattern of what? Activities. Sequence, it is involved in sequences of what? Of motor pattern of what? Activities. Are you there? Are you there? It is involved with what? With cognitive functions that are related to what? Motor pattern of both sequence of motor pattern of activities. When we say cognitive, cognition means what? Thoughts. Are you there? Cognition has to do with what? Thoughts. Now, before you execute any action, you first of all think about it. Is it also? You think about it, and then when you think about it, right? Now, that information that you are thinking about, right, will be correlated with information that is already stored in the memory. Are you there? Are you there? It will be correlated with what information that is already stored in what memory before the information will now be what executed. Do you understand? Are you there? Now, a typical example of this is, for instance, when you see a lion approaching you. Do you understand? When you see a lion approaching you, what do you do? The first thing you will do is to talk. You don't just start running. The first one involves action, immediate what? Action. But this one involves a sequence of motor activities. The first thing you do now is to first of all talk. That's the motor activity. Talking is the motor activity. Right? But before you know, the first one think about what you will do. Yeah. Are you there? A lion is coming. Immediately you start thinking, what will I do? Should I run towards the lion? No. If I run towards the lion will grab me. Do you understand? So the best thing to do, and you know this thing happens in the split of second. The best thing to do is to talk. So you first of all talk. Right? So the circuit that we have to talk is what? The correct, the correct what? Circuit. It will help you to talk. Then the next thing is to run. Is it not so? So you see this another sequence of photo activities. So you see the correct circuit that will help you to what? Start running. And the next thing, as you are running, you still be thinking, what can I do? Because this lion can run faster than me. Do you understand? Are you there? While you are running, while you are executing these activities, you are also thinking, what should I do? What next should I do? I don't have a gun. If I had a gun, I would have brought it out and run it back and shoot the lion. But now, since I don't have a gun, I have to save my life. What should I do? Let me climb a tree. Do you understand? You now start what? Climbing. Right? To get away from the lion. That is a complex pattern. That's a sequence of what? Motor activity that is associated with what? Your cognitive what? Function. Right? And it is correlated with what? The cognitive what? Circuit. Do you get it? Do you get it? Alright, so now let's go to the function. Okay, before we go to the function, let's look at some abnormalities of what? That one should come last. Alright, that one will come last. Let's do the functions. Functions of what? The basal what? Ganglia. Now when we talk about the functions of the basal ganglia, we have to talk about three important functions. And what are these functions? What are these functions? I think I mentioned some, but then what are all their functions? We have what are the main functions of the basal ganglia. Number one is what? Yes, it initiates movement. Let's put it that way. As simple as everyone understand that one. It initiates what? Movement. Are you there? When I say it initiates movement, it actually executes complex pattern of motor activities. That's movement. It also initiates a sequence of motor activities. That's also what? Movement. But let's put it simply as it initiates movement. Right? So number one, the basal ganglia is involved in what? Initiating what? Movement. If it initiates movement, it can also stop movement. So it stops what? Movement. If it can initiate movement and can stop movement, then it can also modulate what? Movement. Are you there? So it is involved in modulation. Modulating what? Movement. So these are the three functions of the basal ganglia. Number one, it initiates movement. Number two, it stops movement. Number three, it modulates what? Movement. We'll take them one after the other. Are you there? Number one, it initiates movement. Number two, it stops movement. Number three, it what? Modulates what? Movement. Are you there? Are you there? Alright, so now in talking about the functions of the basal ganglia, we cannot do away with an important concept which is direct transmission. Alright. So let's take them one after the other. Can we? Can we? Alright, so I will. Can we? Alright, so I will clean this. Clean this. Can I clean it? Give me the permission. Let me know. finish complex. Can I clean it? Give me the permission. Let me know when it finish complex. Let me know when it finish complex. Very simple diagram. Are you there?
Yes, sir.
This is not putamen, right? Globus pallidus what? Externus. Globus pallidus what? Internus. What is this? Corneotomus. So both of them are called what? Both of them are called what? Neostriatum or striatum. So we can actually use the putamen to represent the striatum. Are you there? So let me clean this. Do you get it? Or I should include it?
Yes, sir.
Alright. Let me include the corneotomus, right? Corneotomus. So both of them are called what? For text, right? We send a command. You know where the command is? To the what? Striatum. Via a pathway that, or via a fiber that's called what? Glutaminergic fiber. Glutaminergic fiber or pathway. Are you there? And from here, right? From here, information will be sent to the globus pallidus what? Internus. So fibers will come down to the globus pallidus what? Internus. Are you there? Now from the globus pallidus internus, fibers. From the globus pallidus internus, fibers will go down to where? To the thalamus. Are you there? And then from the thalamus, fibers will go down to where? To the cortex. To the cortex, right? It will turn back to the cortex. Are you there? Right? And then from the cortex, information, a command will now be sent to where? To the spinal cord. So the command will be sent to what? The spinal what? Cord. You get it? So, you don't get it? Now, listen, look at it. This is direct what? Pathway. Direct pathway. Now, this is the cortex, right? Are you there?
Yes, sir.
This is what? The cortex. This is what? The neostriatum or the striatum. Are you there? And this is what? Globus pallidus. Are you there? Okay, let me make it very easy for you so that you understand. Let me remove the cortex so that you know that. Let me remove the cortex nucleus. Should I remove the cortex nucleus? No. Okay, I should leave it.
Yes.
Okay, you understand it?
Yes.
This class is a very intelligent class.
Yes.
Okay, so you understand that this and this are one. They are called what? Striatum. Are you there? Now, information will be sent to the what? Striatum via a fiber that is called glutaminergic fiber or the glutaminergic pathway. Are you there? Now, the striatum, which comprises of the corneal nucleus and the glutamen, will send information down to the globus pallidus internus via another pathway called the what? GABAergic what? Pathway. So this is called GABAergic. This pathway here. GABAergic. This blue one is called GABAergic. GABAergic.
What's the meaning of GABA?
GABA aminobutanic acid. GABA, this one is glutamate. This is GABAergic. Are you there? Pathway of fiber. Any fiber or any neuron that releases GABA is known as GABAergic what? Fiber. Any fiber that releases glutamate is known as glutaminergic what? Fiber. Are you there? This one is also GABAergic. Right? This one is also what? GABA what? Ergic. Because it releases what? GABA. Any blue one there you see is GABAergic. Then this one is called what? This red one is called what? Glutaminergic. Glutaminergic. Glutaminergic fiber or pathway. Are you there? So now, from the cortex, right, information will be sent to the what? Striatum. From the striatum, it goes to the globus pallidus internus. From the globus pallidus internus, it goes to the thalamus. This is the thalamus. This is the thalamus. Right? And of course, it goes particularly to what? VA and the V what? M. In the thalamus. Are you there? Then from the thalamus, it goes back to what? To the cortex. From the cortex, a command will be sent via the corticospinal tract. And this arrow represents corticospinal tract. This arrow is going to the spinal cord. Do you understand? That this arrow is going where? To the spinal what? Cord. Do you get it? Are you there?
Yes, sir.
Do you understand it? Eh? You don't understand? I shall explain again.
Yes, sir.
How will I say this now? How will I make you understand this thing now? Eh? Please go and get me water. Hello? Go and get me water. Go to that office. Tell our secretary to give me pure water. One pure water. Okay? Hello? I must make sure you understand this thing. You must understand it.
Amen.
But why are you confused? What is confusing you? Tell me what is confusing you. Everything here is confusing you. Alright. This is direct pathway. And the direct pathway, you know that we have what? The cortex. Are you there? The cortex usually sends, just like here. And the glutamen. The cortex of the glutamen is called what? Globus pallidus sends information to where? The thalamus now sends information back to where? Back to the what? Cortex. And the cortex, having received the information that is coming from the basal ganglia, now sends a command to where? To the spinal cord via the corticospinal tract. Is it difficult to understand? No. It's very simple. Should I explain it again? No. So that is the direct pathway. Are you there? This is the direct what? Pathway. Right? Did she give you? That's exactly what I'm talking about. Do you get it? Alright, so yes. Say it, coordinate globus pallidus. No, globus pallidus is two. It is divided into two. One is the external part. One is the internal part. Are you there? You will see where the external part will come in. It will come in the indirect pathway. Are you there? Are you there, my friend? Are you understanding? Are you following? Which department? So are you sure you're following? Alright. So now look, right? Like I told you, information is sent via what? A fiber called glutaminergic fiber or glutaminergic pathway. That is to say that in the corneal nucleus and the glutamen, right, at this point, what will be released here will be what? Glutamate will be released here. Are you there? Glutamate. Thank you. over here, release. Are you here? I can clean this now. Let me clean this now. So you understand that this is GABAergic fiber, glutaminergic fiber, glutaminergic fiber. I commonly use red so that you know that this is glutaminergic fiber. This is what? GABAergic fiber. So glutamate will be released here. Are you there? So when glutamate is released here, what will happen? You know glutamate. Glutamate is an excitatory what? Neurotransmitter. Are you there? It is an excitatory what? Neurotransmitter. What does it do? For instance, now this is a neuron, right? In this neuron, right? Let's say this is a channel, an ion channel, right? When glutamate binds to this channel, what does it do? It opens up this channel and allows for the influx of what? Sodium ion, positive what? Ion. This ion will make this neuron to be what? Electro what? Positive, which will now result in the what? Generation of the threshold potential, right? When we have a threshold potential, there will now be a spike, which is known as what? Action potential. Action what? Potential. Now the action potential is actually known as what? ESPS. Excitatory pulse EPSP. EPSP. Excitatory pulse and what? Potential. Are you there? So now, it will result in the generation, this glutamate will result in EPSP. Excitatory pulse and what? Potential. Which will now stimulate this GABAergic what? Neuron. Are you there? It will stimulate the what? GABAergic what? Neuron. Glutamate will stimulate this GABAergic what? Neuron. When this GABAergic neuron is stimulated, what will happen? It will result in the release of GABA. GABA will be released by this neuron here. Are you there? When GABA is released, GABA will stimulate this other neuron. Do you understand? You know what GABA does? GABA is an inhibitory what? Neurotransmitter. So first of all, glutamate will stimulate this GABAergic neuron to release GABA. Glutamate is excitatory. It will stimulate this neuron. When this neuron is stimulated, this neuron is a GABAergic neuron. So what will it do? It will release plenty GABA. Are you there? It will release plenty GABA here in the globus pallidus internus. What will the GABA do? GABA will inhibit this neuron. It will inhibit this other. This is also a GABAergic neuron. Is it also? So the GABA will also inhibit this GABAergic neuron. When this GABAergic neuron is inhibited, what will happen? It will not produce GABA, or it will produce small amount of what? GABA. Do you understand? When this GABAergic neuron is inhibited by this what? GABAergic neuron, it will produce small amount of GABA or no amount of what? GABA. So small amount of GABA will be released here, or no amount of GABA will be released here. So if small amount or no amount of GABA is released here, what will happen? This one is a glutaminergic what? Fiber. It will cause this fiber to fire. Are you there? It will cause this. Now, usually, listen, this GABAergic neuron is always inhibiting this thalamic neuron. Are you there? This GABAergic neuron is always inhibiting this what? This thalamic what? Neuron. This thalamic neuron is a glutaminergic what? Neuron. Now, when this GABAergic neuron is inhibited by GABA, are you there? When this GABAergic neuron is inhibited by GABA, right? It will release this thalamic neuron from inhibition. Are you there? It will release this one from inhibition. This one is always inhibited by this. You know, this is blue, right? Indicating that it's a GABAergic neuron. And a GABAergic neuron is always inhibiting what? Glutaminergic what? Neuron. Are you there? So now, when this neuron is inhibited by GABA here, it will release small amount of GABA or no amount of what? GABA will be released. So therefore, it will now release this neuron from inhibition, making this neuron to fire. And how does it do that? It's fired by producing lots of what? Glutamates. That will cause glutamates. That will fire what? That will stimulate the what? The cortex. When the cortex is stimulated, it will stimulate the cortex to what? Fire. And release action potential that will go down to the what? Spinal cord. And that is how movement is what? Initiated by the direct pathway. Is it difficult to understand?
No.
Very simple. I will explain it again if you are confused. Are you confused? No. God's time. God's law. Are you confused? Are you confused? Okay, I shall explain it again. Now listen. You know we have glutaminergic fiber, GABAergic fiber. Now, like I told you, information is coming from where? From the cortex down to the striatum. Right? Now this information that is coming via a glutaminergic fiber that releases glutamates. What does glutamate do? Glutamate is an excitatory neurotransmitter which will come and stimulate these neurons. These neurons are called what? GABAergic what neurons. When they are stimulated, they will release what? Plenty GABA. So when they release GABA, that GABA will be released here. Do you understand? I will come and inhibit this GABAergic neuron. So when this GABAergic neuron, this other one is inhibited, it will release small amount of GABA or no amount of what? GABA. Thereby releasing this one from inhibition. So when this one is released from inhibition, of course if there is no GABA here or small amount of GABA because of the this receptor or channel. When the binary channel happens, it will result in what? Efflux of potassium or influx of this GABA neuron to release what? GABA. GABA will stimulate this neuron, right? This neuron. Yes, sir.
Yes, sir.
You know, we talked about the control. Are you there?
No, sir.
Yes, sir. It will send. Do you understand? It will release GABA and GABA. It will release GABA and GABA will inhibit. This neuron. If I talk this
Excite the subthalamic nucleus and thalamic nucleus and releases sorry, that's my
neuron right in the striatum that is going down to globus pallidus externus first, not the thymus. Globus pallidus externus first, not the thymus. Are you now when this are you there? When it is inhibited, it will produce little or no GABA. Are you there? The subthalamic. Are you there? The subthalamic nuclei is always exciting. The nuclei is always exciting the globus. So it will now release this other neuron from inhibition. When this neuron is released from inhibition, it will because it's a GABAergic neuron and it is excited by this one. So when it is excited, it releases GABA. GABA will inhibit this other neuron. Are you there? When this neuron is inhibited, it produces down here, right? excites the lytic neuron that goes from internus. That will excite this one, that will go to internus. No, that will go to thalamus. From here, it will now excite this neuron that will go to what? The cortex. And then it will send the what? Come out. Are you there? Now, I want to show you the involvement of what? The substantial diagram. Are you there? Now, this is substantial diagram. Are you there? This is pars compacta, pars what? Pars compacta is highly dopaminergic. Are you there? It has lots of what? Dopamine. And then it's called the D1 receptor. It's called the D1 receptor. That does the nucleus pathway and the indirect what? Pathway and the indirect what? Pathway. It modulates the function. It modulates the function. Right? It modulates the function of what? The direct what? Right? It modulates the function of what? The direct what? So glutamate will excite. He repeats this what? Neuron. When it are you there? So that is of the negro what? Negro striatal pathway. Now this one has a clinical implication. If this negro striatal pathway is destroyed, if there is a lesion here or a lesion here, and dopamine is not produced, right? It will result in what is called Parkinson's disease. Or what we call Parkinsonism. I know that Parkinsonism is characterized with what? Rigidity. Akinesia characterized with what? Rigidity. Akinesia. Akinesia. Difficulty in initiating what? Movement. Rigidity. Are you there? The hands and legs will be what? Very stiff, rigid, and tremors. Are you there? Tremors. The hands, the wrist will be what? Shaking and trembling. That's what called Parkinson's what? Disease. And it is associated with what? The neurocycle pathway. When the neurocycle pathway is damaged, or when there is a lesion there, it is substantial diagram or whatever, it will cause what? Parkinson's disorder. Are you there? Now let's go to the indirect pathway. For the indirect pathway, you know that usually the indirect pathway usually stops movement, but the activity of the neurocycle pathway increases movement here. Are you there? Let me show you how. This is what? This substantial what? Ligand. Are you there? And of course, okay, let me draw it here. This is substantial diagram. Are you there? So it sends information down here and information down here. So this is called the through what? Striatal what? Pathway. Right? And it carries out this function via a receptor that is called what? Yeah? D2 receptor. D2 receptor for the indirect pathway. Are you there? For the indirect pathway is what? D2 what? Receptor. Now it enhances, it slows down what enhances. Right? This one slows down the activity of this. Now glutamate is supposed to what? Fire. This glutaminergic factor is supposed to fire against what? Glutamate. But when these D2 receptors reduces the activity of this neuron. So So when this neuron, when the activity of this neuron is what? Is reduced. Or when this neuron is inhibited, it means that it will not produce what? Glutamate. Do you understand? Or it will produce little glutamate, which will not excite this neuron. Do you understand? So this neuron will not be what? Excited. If this neuron is not excited, it means it will produce small amount of GABA. Are you there? Small amount of GABA will be produced here. If small amount of GABA is produced here, it means that this neuron will not be inhibited. Do you understand? So if this neuron is not inhibited, it will produce large amount of GABA here. Plenty GABA, which will inhibit this neuron. Now this neuron, when this neuron is inhibited, it will produce small amount of glutamate here. So if small amount of glutamate is produced or no glutamate is produced, this neuron will not be excited. Do you understand? If this neuron is not excited, it means that it will produce small amount of what? GABA. Small amount of GABA or no amount of GABA will excite this neuron. Do you understand? Are you there? So both for the direct pathway and indirect pathway, the nucleoside pathway actually enhances activities. Are you there? So instead of stopping this movement, it what? Enhance the movements. Do you understand? It will enhance. Normally, indirect pathway stops unwanted movements. Are you there? So now, the indirect pathway does not stop unwanted movement. Alright. Enhances unwanted what? Movement. Are you there? So now, if the indirect pathway is destroyed here, if the nucleoside pathway is destroyed here in the indirect pathway, what will it cause? It will cause what? Huntington's disease. Huntington's disease. Huntington's what? Disease. Now, let's go to the clinical implication of laser ganglia. Clinical implication. I should explain that again. Nucleoside pathway. It is characterized by what? It is characterized by what? Inertia. Then we have heavy ballistic. This one is actually, it involves the movement of the hand and the face and the head. We call it accessory, right? The feeling movement of the legs. Sorry?